Hello, Internet. I'm gonna try as hard as possible to keep this relatively short. Seems like several of my videos lately have been getting into the 14, 15 minute, 17 minute range. And I'd like to keep this one a bit shorter, so I will jump right in. I've mentioned in the last video or two that I would have scans coming up and appointments and some kind of breakthrough moments, forks in the road, and that has indeed happened in the last several days. I had CT scans on Thursday, had a video call with my hepatic surgeon, that's the liver surgeon, on Friday, and then yesterday I had blood work, oncology, and my sixth panitumumab infusion. So it's been busy the last several days and kind of a lot of information to go over as well. But again, I want to keep this kind of to the point for you guys because I know many of you are checking in. I've had texts from quite a few people asking me what's going on. So anyway, bottom line is we have basically good news. My scans last week showed very good response to the drugs, to my treatment, which has been ongoing since February the 19th. So really, it's just been a little over 2 months since we started this latest round of treatment. But the CT scans show that the 2 lesions in the liver shrunk by 3 times. That means they are 1/3 the size of what they were 2 months ago, which is now down around 1 centimeter. Both of them. I think one of them is actually less than 1 centimeter. Then I have it's called a, oh gosh, I can't remember the name of it, but it's a lymph node near the portal vein or something in the liver. And it was about 1.5 centimeters. Now it's down to a little bit less than 1 centimeter. And then you guys have heard me talk about these midline soft tissue nodules, my mid-abdomen, which I've been able to feel when they grow. Those have also shrunk by about half. I can't even feel them anymore. So let's see, what else is there? Oh, you know, I've had some small spots in my lungs, but they are so small, and they have been so small ever since the ablation that I had back in September of 2023. So that's now more than 1.5 years ago. There has been nothing in my lungs that they're really concerned about, because although there are little spots, they are on the order of millimeters, most of them just 1 or 2 millimeters, and even without treatment, they weren't progressing or growing very much. So we're not even sure if that's metastatic development in my lungs. But anyway, the point is, whatever is there is not doing anything. It's either shrinking or disappearing or remaining extremely tiny. So again, the main issue is the lesions in the liver, the lymph node right adjacent to the liver, and then these soft tissue nodules. But everything, according to CT scans, is being very well managed, shrinking substantially. In fact, both doctors that I talked to, the hepatic surgeon on Friday and my oncologist on Monday, both of them used the same word, remarkable, as far as my response to treatment. So I'm really happy about that. I'm super grateful. You know, not everybody responds to this treatment. Before I ever started this particular cocktail, which is panitumumab, the infusion, it's actually a monoclonal antibody, epidermal growth, I knew I'd screw that up. Anyway, you can look it up, panitumumab. It is technically not a chemotherapy. It is a monoclonal antibody. It is a targeted therapy. Capecitabine pills, that is a traditional chemotherapy that I take orally. But anyway, this cocktail that I've been on way back last summer, just about a year ago, when we started talking about getting on this treatment, my oncologist at the time told me that actually only about 30 to 40% of people have a real positive response. So, you know, he kind of, when we started this, he sort of set the stage for me so that I wouldn't be disappointed if it didn't work very well. But they have said that I am the model patient for this cocktail of drugs. And as you know, even though I'm struggling with side effects, I'm just so happy that it's working and that apparently I am in the top percentile of patients who respond very favorably to the treatment. And, you know, it's kind of eyebrow raising, they say, you know, that I'm doing so well. So there you go. Already I'm up to 6 minutes. Sorry, guys. Anyway, the news is we decided yesterday that we're going to drop the capecitabine, which is the oral chemo pills, because that's the drug that's really responsible for my horrible issue. Check this out. It's so painful. It's maybe starting to heal up a little bit. I think maybe we've peaked and it's starting to get a little bit better. But anyway, they call it hand and foot syndrome. Last summer, I had blisters on my feet. This year, my feet have been okay, but the fingers, they are just painful all the time. I've tried little rubber finger cots. I have numerous different kinds of lotions and creams and ointments and tallows and things like that. And they provide some soothing relief, but nothing really heals this. And again, I've talked about this before. I don't want to spend a lot of time on it, but it's the hardest of my side effects because you need your fingers and I'm bumping them all the time, scratching and scraping and clawing and yelling and screaming. People can hear me in different parts of the house when I'm yelling because I've whacked my hands on something, you know, trying to do dishes or open a Tupperware container. You know, it's just life. And open a cereal box. Try to open a cereal box with this. It's just like, oh my good grief. But anyway, the point is we're going to stop these pills as of right now, effective immediately. That means it's been a whole week because they're 7 days on and 7 days off. So it's been more than a week since I finished the last cycle of these pills, but we are going to continue on with the panitumumab infusion. We're going to do 2 more, mid-May, the end of May. So, you know, I'm not done yet, but we decided the treatment is working so well, and we want, as long as we're making progress, we want to keep making progress, and we want to get ahead of it. That'll be a total of 8 cycles of the panitumumab by the end of May. 1 month from now. I will go back in middle of June, 6 weeks from right now, and we will do another CT. We will also do another CEA, which I already told you, my carcinoembryonic antigen, which is a tumor marker blood test, is super low. It's all the way down to 0.5, which is in the normal range. So, but we're going to do that again. And then everybody says, hopefully, they will be able to pat me on the butt and send me out the door for a while, hopefully several months. Let's see. But so that's the news. It's basically good news. I don't like being on treatment. I told them, they even asked me, they said, do you want to quit? Do you want to stop? And I said, I don't want to be on treatment anymore. You know, it's only been a little over 2 months, but it's no fun being on treatment. You guys have been on treatment, you know. It's not fun at all. But again, it's working. I'm getting positive results. I'm very grateful. And let's finish out a full 8-week course. So I'm going to take a deep breath and put on my big boy pants, as I've been saying. And we're going to finish off 2 more cycles of the panitumumab monoclonal antibody targeted treatment. That's what it's called. So anyway, here I am already up to 10 minutes, and I was going to keep this short, but thank you guys again. I've been just bombarded with texts and messages, and there's so many of you out there who it really blesses me and makes me feel supported like crazy to see your messages and have you guys check in with me. And I wanted to get on here because I know there's dozens and dozens of people who this is your main source of information. So that's the story. I'm feeling pretty good other than the fingers and the occasional fatigue. And I've got other skin issues, but they are manageable. The fingers is the only thing that's almost like a deal breaker for me. And that's why I'm glad that we had the opportunity and the option to drop the oral medication, since that is responsible for the finger stuff. So anyway, I'm going to stop now, and I'm going to thank you again very much for your prayers and your love. And April is ending and May is coming. Springtime continues to unfold. I know it's summer for some of you already, but anyway, thank you so much. Bye-bye.